ഇന്ന് നമ്മൾ എത്തിയിട്ടുള്ളത് സൗദി ജിദ്ദയിലെ ഷിഫ അൽ ബവാദി മെഡിക്കൽ സർവീസസിലാണ്. ഹെൽത്ത് പ്ലസിലേക്ക് എല്ലാ മാന്യപ്രേക്ഷകർക്കും സ്വാഗതം. ഇന്ന് നമ്മോടൊപ്പം ഉള്ളത് ഷിഫ അൽ ബവാദി മെഡിക്കൽ സർവീസസിലെ ഡോക്ടർ അബൂബക്കർ. ഹായ് സർ.
Hello, hi. Assalamu alaikum. Yes.
Sir, so you are specialized in which branch?
Yeah, actually I'm an internist. I have done MD in internal medicine. Then I have done this diploma in diabetes and fellowship in diabetes mellitus from UK.
Oh.
So I'm seeing all internal medicine cases, plus particularly I'm focusing on diabetes, hypertension and cholesterol problems.
Okay, sir. So since how long you have been
I
working?
have been here since almost 20 years.
Okay.
So before I was working in some other medical centers. Now I have joined the Shifa Bawadi since last 4 years.
So what do you think the reason behind all these lifestyle diseases that are being increasing day by
Actually,
day?
surprisingly for the last few years I am seeing that cases of diabetes and hypertension, high cholesterol levels are increasing too much. Actually, there are so many reasons behind this. The most common reason I have seen is because people they are following this modern Western type of lifestyle, these habits. They are eating mostly fast foods and they are not doing proper exercise, and they have lot of they are taking a lot of mental stresses also. Usually we have to do exercise at least minimum 20 minutes per day, brisk walking, or like that. If you do more than 150 minutes per week, that is good for our health. If you do more than that, that is better, but at least we have to do this much. If you are doing less than 150 minutes per week, it means you are physically inactive.
What is the age group that is coming to you mainly?
Yeah,
with all
actually
these
before 10-15 years before, usually the people more than 50-60 years of age, they were having all these problems. But nowadays, younger people are having these problems more commonly. I'm seeing particularly people from Bangladesh. I don't know their eating habits are, they eat lot of carbohydrates, white rice, white bread, and this thing. Because of that, they are getting diabetes after the age of 30 also. So this is really disturbing type of things, because if they get diabetes by the age of 30-35, by they reach 50 or 55, usually they have multiple complications, and then they will have renal problems. Then they have to go for dialysis. They have nerve problems, they have to go for amputation. They have eyes problem, then they have to go for eye surgery, or even sometimes some people will get blindness also. So this is the high time that general public and doctors and paramedical staff should, we should educate the general public that how to lead the life properly, so that we will not get all these metabolic disorders so early in the life.
According to these diseases, what is the main treatment that we can provide to the
No, first
young
of all, we have
generation?
to, in all these metabolic diseases, chronic diseases, we have to educate the patients. This is very important, because the first line of treatment is to educate the patient what to eat, how to eat, when to eat, and how much exercise they have to do, how much sleep they have to take. All these things are very important, and the patients also have to remain, stress free. I know nowadays everybody has stress, but we have to learn how to, tackle the stress. This is very important in the life. If you don't do all these things, and particularly in the Gulf countries, people are working away from their home and family and this thing, so they have to be more careful, extra careful, because they have to live their own life normally, and they have to look after their family also. So I advise all the patients that please follow these things. Check with your doctors regularly. Do your blood sugar test fasting, or after meals, at least once in 3 to 6 months. If the fasting is more than 110, and if the postprandial, that is after meals, if it is more than 140, then at least you check your doctors, and do all other tests like we are doing. They call in Arabic trachomy. Trachomy is glycohemoglobin, or HbA1c. If that is normally, it should be less than 5.7. If it is in between 5.7 to 6.5, it means you have high chances of getting diabetes in the near future. If it is more than 6.5, it means you have diabetes. So regular checkup, then exercise and a proper diet, all these things will definitely help.
Any bit of advices for our younger children, starting from the very younger age?
Yeah. Actually, now young children also I am seeing, particularly in Saudi Arabia and the Gulf countries. In the morning, I have seen all the children. They go to school with a sandwich in one hand and Pepsi in another hand. This is their breakfast. This is not at all good. They have to eat proper, healthy diet. High protein diet. This is very important because at that age, if they are eating all these things and they are gaining weight, because nowadays obesity is more common in children also. Before, children usually were obesity was less than 5%, but nowadays it is obesity rate in children is somewhere between 15 to 25%, which is not good, because in the future they may get diabetes also, they may get other problems like cholesterol problems, hypertension problems, joint problems, all these things are there. So it's better that even parents, they have to take care of their children, because children, they don't have that much knowledge about diet and everything. So as a parent, we have to educate them, we have to give them proper diet and proper advice.
It was very nice talking to you,
Thank
doctor.
you.
You educated
Thank you.
us very well. Thank you so much, doctor.
Thank you very much.